Hello dear followers and patients, I'm Dr. Ahmedov, hair transplant surgeon from Smile Hair Clinic. Welcome to our channel. Today I would like to have a small brief with you about one of the most common questions we get from our patients lately, specifically for the last 2 years. It is, can the patient have a beard and hair transplant surgery at the same time? So a simultaneous surgery of the hair and the beard. Yes, it can be done, but there are some points we have to keep in our mind. The higher is the grade of the hair loss, the more grafts he may need, okay? And the less number of the grafts will be left for the beard transplant. Number two, what are expectations of the beard transplant? Is it completely bald face when there is nothing exists, or the patient has the beard and he needs some densification? Does he need to rebuild only the sides, sideburns, or the whole face, including the mustache and the front side is also needed to be like reconstructed or filled? So there are many variables. There is some general rules we follow up for this one. Number one, when we evaluate the patients, the first thing we do is that to decide what's the priority of the patient. Is it the hair or the beard? After that, number two, what's the degree of the hair loss? After we decide what's the need of the graft for the patient, we skip to the beard. What's the size? What are the expectations? Is it a completely open area or is it just densification surgeries? Do we need to rebuild the whole face or it's just a partial, or there are like some islands of the hair loss? Is it like a bone situation, or the patient had never had a beard, or he had it but has lost it due to some diseases, maybe trauma? These are all the factors we have to keep in our mind. Beard transplant can be done at the same time. But here the key question, or the key point, the most important point actually for us, is the capacity or the ability of the donor area to give a sufficient number of the grafts to meet the expectation of the patient for the hair and the beard. Today I want to show you one example of how of an appropriate patient that matched the criteria for the combined beard and the hair transplant surgery. Okay, here is an example of the patient who had a combined hair and the beard transplant surgery. As you can see from the picture, the excess or the degree of the hair loss the patient had is really low. It's actually a normal type 2 of the hair loss, meaning that there is a minimal recession or the loss of the continuity of the front hairline. The main loss areas are actually on the temples, or we call it the frontotemporal area, the transition from the front line to the temples. So it's like not a very aggressive or progressive type of the hair loss. The number of the grafts we may need for this type of hair loss for individual patient may differ, going from something between like 1.5 to 2,000 grafts. Of course, the number of the grafts here may change as well, depending on many factors. Number one, the size of the open area. The patient may have a big area, like big head, so the area is of course slightly bigger as well. Number two, the density of his own hair. Okay, the patient may have slightly thinner hair all across the head, so when you do the implantation with a super high density, okay, it may look really weird having slightly more dense hair in the front side and slightly less dense at the back of the head. So we need to match the density the patient has across the head. The patient's own density is pretty high. That's why we need to match it so it won't stand out. Our plan was the reconstruction of the front hairline, filling up the temples and reinforcing the front line first of all. And number two, the beard transplant. The patient lacked, he had some mustache and the front side or gold beard as we call it on the sides, but the both cheeks, sideburns were slightly weaker. So the plan was the reconstruction of the beard on the sides. We'll show you, you can see it from the picture actually, and filling up and link up the beard to the beard and mustache in the front side. For this type of surgery, our preliminary plan was the numbers something between 4,000 and 4,500 grafts. The patient's donor area was pretty good. The size, the density, distribution, none of the multiple follicles, they were all in a good condition that were raising the chance of increasing the number of the grafts, because every once in a while we may need to slice actually or chop down the multiple grafts under the microscope to the singlets, or in some cases for doublets. It will raise the number of the grafts and give us the chance to increase the coverage area. So the planning was done, the front hairline was reconstructed, and after that we went with the extraction. Our initial plan with the distribution, it was a mega session of the number of around 4 to 4,500 grafts. We made a big extraction area marked and tried to stay within the safe donor zone. We were lucky to have a good donor area, and we stayed within this area. Here you can see the planning of the patient actually, when after we shave actually his hair. You can see that the most of the hair loss is actually in the temples and the frontotemporal side. Okay, we call it sometimes as a horseshoe pattern. It's like a U-shaped in the corners and slightly thin in the front side. Because the patient's own density was high, as I told you, we plan to go with the high density implantation of around 40 to 60 grafts per centimeter square in some areas. And after we were done with this one, we planned his beard transplant. The priority number one was to rebuild the sideburns because he was lacking them, and fill up the cheek, make a connection between the cheek side and the frontal part of the beard, the mustache, and as we call it every once in a while, the front forebeard or the goat beard, maybe in mostly commonly used. Okay, the sides actually, the bottom was pretty fine, and he had some beard under the neck region as well, so we didn't have to go too much deep into the neck region. So that's the right side of the face after the drawing and marking the areas, and that's the left side. The height and the angle of the beard is actually very individual, but we don't like going with super high height of the beard. Actually, it depends of course of the anatomy of the face of the patient, okay, and his or her expectations. The only thing we have to keep in our mind is that every once in a while, depending on the number of the grafts of course and the patient's expectations, the beard transplant may require second surgeries for some densification, but it depends on the patient. As we told, it depends on patient expectations, the number of the grafts, the distribution of the grafts we planned for this patient. So the plan for the patient was the reconstruction of the front hairline, filling up the gaps in the temples, beard reconstruction, sideburns, cheek region, the front mustache, and link up. And the number of the grafts we were able to get from the patient was 4,500 grafts. After extracting the grafts, we made the measurements and made more or less an exact number of the grafts the patient may need for the hairline and the hair. Actually, with the calculation was showing the number between 1,600 to 1,800 grafts. We made the incisions, and the number of the grafts we needed for the hairline and the hair itself was 1,750 grafts. After that, we measured the beard area, and for an average density of around 30 grafts, 30 to 35 grafts per centimeter square, the patient needs for the beard and the reinforcement of the link up of the cheek area to the front side, the patient needed the number something between 2,600 up to 3,000 grafts when we measured per centimeter squares. So 1,750 grafts were used in the hair, and the rest 2,750 was evenly distributed on the facial area of the patient. And I will show you some of the pictures of the planning before and after the surgery, the donor area, and I would like to show actually him with the hair as well. We can see that the corners, they're receded. It's very actually common to see the hair loss or receding of the line, specifically the temples, where most of the time starts with the male patients. We have the rule of 30 that we say 30% of the males at the age of 30 have the hair loss. Okay, at the age of 50 it goes to 50%. That is the rule of 30 and 50 every once in a while we mention for the patients. Okay, now I would like to show you the results. The good point is that specifically the most common question we have with the patients who undergo a combined surgery for the beard and the hair, what's the recovery time? The recovery time is more or less the same. For the hair, for the donor area, the recovery time is around 7 to 10 days. For the transplanted area, for the hair, it's around 10 to 14 days for the good recovery. Facial part, because the face blood supply is really rich, the recovery goes really fast. And around day 7, we already have a good scabbing, and around 7 to 10 days after the surgery, it has completely recovered and the scabs start to come off. So this is the patient 2 weeks after the surgery when all the scabs were off of the head. This patient, we can safely share his picture because he has his own consent to share and show the results. Okay, he started his shock loss of the hair pretty early. That's why the density is slightly lower here. We can see the facial part. One of the tricky points that most of the we have to pay attention, or when you pick up the clinic, is that ask for the results of the beard transplant the patient had, because the beard transplant technique is slightly different compared to the hair. For example, in the hairline, in the front side, when we do the surgery, the angle and direction of the hair is slightly different. For example, in the front side, the angle is something between 15 to 20, maybe in something up to 25 degrees. It's slightly lower actually. So the hair should grow slightly downwards, but the facial part is completely different because the hair here grows slightly downward and the directions are different. For example, sideburns come directly here and give a small tilt or turn to the inner side of the neck. But when it comes to the cheek region, it gives a small deviation and grows slightly in different direction. So it's very important to give the direction, that's number one, but the angle of the incisions for the implantation is also crucial because the incision should be done almost like parallel to the skin. Why? Because the beard should grow downward. That's how natural it looks, okay? Otherwise, if the angle is slightly more steep or sharp, the problem will be you're gonna look like a hedgehog with the beard coming out like really straight, and it's really unnatural look. It will make you look really weird, and it's very hard to fix these kind of problems in the future. Here we can see that we have achieved the direction. That's very important, okay? It looks in a natural direction, how the beard should grow. For example, the cheek region grows differently, mustache grows differently. So the surgeon and the team who perform this kind of surgery should be very familiar with the face anatomy, direction of the hair, specifically in the facial region. So please pay attention to this one and ask for the original pictures of the patients who have the consent to share it with you. So, and here I would like to show you the result of the patient after the 12 months. I would like to start from here actually. First of all, you can see from the top, we equipped in the front side almost the same density that the patient has, so it doesn't seem that he had the hair transplant surgery. In the front side, the hairline is really natural. It has some thinning areas as well that makes it look much more natural. So the biggest point here is that, so if someone looks at you, they shouldn't understand that you have had a hair transplant surgery. And we can see the beard here actually. That's the donor area, by the way, after 1 year after the surgery. Here is the very big misconception. Every once in a while we hear the point like, hey, FU is a scarlet surgery. Never and ever. Don't buy this lie, please. Any surgery, any surgical intervention will leave the scar. We have an FUT surgery or FUE surgery. In FUT surgery, you may have a strip-like or long scar, but in an FU you will have small dot-like scars. There is no scarless or scar-free surgery. Please don't believe this lie. Of course, in a FUE surgery, because the extraction is done with a small punch, there are small dot-like scars, and when you keep your hair long, it can be masked, but it's not the scarless surgery. But it was a mega session with 4,500 grafts, and you can see the donor area has recovered pretty well. The tricky point here is also going with a good haircut, slightly shorter to the bottom, slightly longer to the top, so it can like a curtain mask small areas. Like a couple of years after the surgery, when the scar tissue will mature, the scars will become even less visible. And here is the result of the beard actually. You can see the direction, the density, the start point slightly thinner at the beginning because we use thinner hair or fair hair that we get from the nape zone at the back of the head is used for the very beginning of the beard and the hairline actually. The direction of the hair, the direction of the forebeard and the mustache, it goes with the natural directions. So